Those who champion health care reform bills are breathing a sigh of relief this morning, at least for one bill, the Senate health care bill that is most closely observed as a new budget office analysis comes out. And let's go to George Stephanopoulos, who will give us the bottom line on what all this means this morning. George,
hey,
I'd like to begin always, if I can, with the simple question I think a lot of us ask every day. Will there definitely be a health care reform bill this year, and how soon?
The odds have gone way up, Diane. This news from the Congressional Budget Office is the biggest boost the White House has had in weeks, because it says that this bill in the Senate Finance Committee meets the president's major bottom lines for health care reform this year. So I think the odds have gone way up, and it's likely to happen before the end of the year.
Take us through those numbers.
Here are the bottom lines the president laid out that are met by the Senate Finance Committee bill. Number one, it comes in under $900 billion. That was a red line for the president. It comes in at $829 billion. Number two, it doesn't add to the deficit. In fact, over 10 years, it actually brings an $81 billion reduction in the deficit, and even more after that. And number three, it increases coverage. It covers 29 million more Americans. So this means that 94% of all legal residents in this country will be covered. Now, there's still some opposition here, Diane. Republicans will say, look at this, you're paying almost $1 trillion and you're still leaving 25 million Americans uninsured, and you're paying for it with Medicare cuts and tax increases. So there's still a fight ahead, but there has been major progress now.
Okay, can I switch to another topic then? Afghanistan, as we know, another big meeting yesterday, although we were told that the entire meeting at the White House yesterday was in fact about Pakistan. Something new being planned for Pakistan?
Well, the president has always said that his policy has to focus on both Afghanistan and Pakistan, and the meetings the rest of this week are going to focus on Afghanistan. But Pakistan is critical. And one of the big arguments you hear in the White House, Diane, is that Pakistan is the home of most al-Qaeda right now, is the place where we have the largest al-Qaeda threat. And of course, Pakistan has nuclear weapons. So that should be where the focus is. One of the other figures you're hearing more often now from White House and administration officials who are arguing for more of a focus on Pakistan than Afghanistan is that there are now fewer than 100 al-Qaeda in Afghanistan. The big question is, if the Taliban takes over in Afghanistan, will al-Qaeda come back?
A question about timing again. With this acceleration of the meetings, does it mean that there's going to be an announcement of a new strategy for Afghanistan coming up sooner than we thought, maybe at the end of next week, the following week?
You know, I've been asking about that, and the best guidance I have is still late October, early November. But it is true, Diane, that the president has received the troop increase request from General McChrystal. That's a major step.
Okay, George, our thanks to you.